Okay, Dr. Glynn, first of all, how close are we now to rolling out vaccines in Ireland, and how concerned should people be?
So the European Medicines Agency expect to meet on the 29th of December for the first vaccine, which is the Pfizer vaccine, and then around the 12th of January for the Moderna vaccine. So subject to favourable evaluation, we'd expect to see vaccine rolled out hopefully in early January.
Even people who aren't, normally anti-vaxxers or anything like that, would have, I suppose, concerns that everything is happening very fast and might not know the full side effects of any of these vaccines. What would you say about people who are concerned?
Sure. So first of all, to say that I have questions myself about these vaccines, and I'll be looking at the data as it comes out very closely over the coming weeks. It's very understandable. It's normal to have questions about something that's been developed so recently. But our job over the next few weeks really is to answer those questions and to make sure that people have all of the information that they need to make informed decisions about getting the vaccine. We are heartened from our research, which suggests that the vast majority of people in this country intend to get the vaccine once it's made available to them. And I suppose I'd urge people not to be unduly swayed by a very small but loud minority of people who are completely against any vaccine, and regardless of what evidence there would be available, would be against getting a vaccine. So don't focus on that, but have your questions and make sure that your questions are answered before you make your decision.
What are you saying to reassure people about the speed at which this vaccine is developed?
So these set of vaccines, I suppose, have been developed in a timescale that we would never have envisaged even 1 year ago. But we've seen levels of scientific and medical research never previously seen around vaccine development. We've seen levels of investment never previously seen. One of the things about COVID is that because there's been so much of it in the world, it has allowed the companies developing the vaccines to very quickly see whether or not their vaccines had an effect on people who got the vaccine versus people who didn't or got the placebo. And then on top of that, normally in vaccine development, you do one step in the process and then do the next step and then do the next step. Whereas this time, many of those steps have been run in parallel. So for example, many of the companies started manufacturing their vaccines even before the results of phase 3 trials were available. And all of that really means that we'll be in a position based on very good evidence, hopefully around effectiveness and safety, and subject to favourable evaluation from the EMA, to start rolling out these vaccines as soon as the evaluation comes through at the end of the month.
How soon can people expect a change in the way we're living?
So I think it's important that people understand that obviously as soon as I as an individual or you as an individual get this vaccine, obviously it will afford individual level benefits. But we have to be realistic, and I think it's reasonable that people would not anticipate a major change at a population level in terms of what we have to do to protect ourselves for at least the next 6 months. Remember that what a vaccine does is that it protects you if you're exposed to the virus. But what we want people to continue to do is to stop themselves getting exposed in the first place. And they can do that by wearing masks, keeping their distance, washing their hands, and continuing to do all the things that we've been asking people to do over the past year.
Do you anticipate maybe by June, July next year we could be out of this cycle of suppression and the disease?
So obviously that's what we all want, but I don't think we should speculate at this point. There are still too many questions to be answered. Now, many of those questions will be answered quite quickly over the coming weeks, but really we need to see what the EMA says. We need to see what other vaccines come through, what the evidence is around those vaccines in terms of how effective they are and how safe they are. And it's only when we have all of the information that we'll be able to give people more information about the likely trajectory for 2021. But people, I think, can be reasonably confident that 2021 will be a much brighter year than the one that we've just had.
Finally, how important is the role of healthcare professionals in combating this fear of vaccines and helping to encourage people to take it?
So they're doctors, nurses, pharmacists are absolutely central to the rollout of any vaccination campaign, but perhaps never more so than over the coming months. We know that people turn to their GPs, we know they turn to pharmacists as trusted sources of information, and as I say, that will be really important over the coming months. And again, a job for us is to ensure that as soon as that we have the information, that we in turn pass that out to GPs and pharmacists so they have the information to hand. I would urge people as well, though, that have questions, as well as their GP and pharmacist, to make sure they're going to trusted sources online. So to go to the HSE website, go to gov.ie, there's lots of information there. Don't be swayed by rumour or misinformation, because you're almost certain to come across some of that over the coming weeks and months.